pleasure to welcome Dr. Elliot Justin to the show. And Elliot, I'm just to let the audience kind of know where we're heading with this. We're just now meeting each other, had a little bit of pre-show, and we've collaborated a little bit email prior to meeting. But I'm going to just kind of look to you as the MD to educate me on what you have discovered and what the benefit is when you jump into this world that you're in on the idea of nocturnal erections being a marker not only for sexual health, but also just cardiovascular health and health in general. And so let's jump into this that is your world with FirmTech and teach me everything you know.
Sure.
In a short time. Let's go.
And I would call it this point I call a mission. This came to me almost providentially. A background in emergency medicine doctor, and I've been doing medical technology since 2015. I became very interested in remote patient monitoring techniques. A urologist about 3 years ago challenged me with coming up with a way of counting men's nocturnal erections, telling me that they're a leading indicator of men's cardiovascular health. Well, I had no idea. And I think and most doctors don't know this, and almost no one in the public knows this. So we all know about, morning wood, and we laugh about it. But we don't. But a man needs to have more than just that one morning erection in order to know that he's healthy, both sexually and cardiovascular wise. So in medication, when we say leading indicator, that's really powerful. And then this doctor told me that, it took me aback, because in medicine we treat associations. High blood pressure, for example, is associated with stroke and kidney failure and heart attacks. It's not causal. It doesn't predict. It's associated.
Right.
Well, it is causal, but it's associated. When we say something a leading indicator, we mean it's predictive. So if the average man in the past was taught should be having 3 to 5 nocturnal erections per night, we now have learned otherwise. If that number goes down, that man will, in 2 or 3 years, likely have a heart attack or a stroke. So this becomes like a sixth vital sign, and certainly one that's a lot more exciting and inspiring to men than almost any other vital sign that he has. We live in this age of healthcare wearables, smart watches, smart rings, etc. Lots of people follow their data, but what do men care more about? Let's be candid. How many steps took yesterday, or the status of their sexual health, the status of their erections? So when this doctor told me that, I was really surprised, and I thought, well, why are we limiting ourselves to nocturnal erections? Let's come up with a way of monitoring all erections. These men are much more interested in what's going on, especially as they get older when they're trying to have sex, than in what's going on overnight. So that led to, in order to do that, I had to reinvent what's people commonly called the cock ring or an erection ring. Mm-hmm. And because I needed to come up with something that was made out of a comfortable material, not hard silicone, we use an elastic. So it can be worn overnight and also be worn during sexual relations. And we have changed people's lives with this. We've documented probably close to 45,000 erections. So we have a database of sexual health that no one else in the world has. We know now how many erections a man should have at night, not just overall, which is 3 to 5, but per decade as they age. So utilizing that data, men and healthcare providers can measure the impact of diseases, and these are the real pandemics: diabetes, hypertension, obesity, atherosclerosis. These aren't government-made pandemics. These are significant chronic diseases that are damaging people's lives and shortening people's lifespan, and they can measure the impact of diseases because medications, because doctors are a big part of the problem. In 2 ways. One, I'll speak of the profession. We never ask about sexual health. What the heck is that about? And I'll be candid with you. It's about money. If there were a box, an electronic health record that said, gee, Dr. Corey, you're here for your annual physical visit, or you have high blood pressure, or you have diabetes, whatever, you come into the office, I must ask these questions in order to bill you for a complete office charge. There's nothing about sexual health there, so we don't ask. And then there's this sort of general inhibition about sex that people have about talking about it. But if there's someone you should be able to talk about it with, it should be your doctor. I've never had a doctor ask me about my state of my marriage. Think about that. I've never had a doctor ask me about the state of my marriage. This is the most problem for everyone: their marriage, or their major partnerships, or the fact that they're alone. This is so important to people. It's such an enormous point to both happiness and stress, and doctors never ask about this
Right.
critical factor in people's lives. I've never had a doctor warn me about the sexual side effects of medication. My wife was never the same. Yes, it's true that as she get older, the doctor says, well, maybe
Yeah.
you should get some estrogen cream. But that's about
Right.
the extent of it. So it's really, and the end result is we have a significant problem with sexual health in this country. And why is sex so important? Well, you're defying nature if you just deny that. We're not supposed to be celibate. If we have sex daily, think about this. If we have sex daily, our cortisol levels, the stress hormone, are half of what they are if we have sex twice a month. And people go to the gym regularly. People need to have sex regularly in order to deal with stress, among other things. Hey, you can take a pill, you can drink, you can get high, or you can have sex. I mean, it's kind of like, well, why are we recommending this? The divorce rate is halved. People have sex twice a week versus people have sex twice a month. The divorce rate is halved. Well, divorce is traumatic to people and to their children, et cetera. And in my life, I'm 71 years old. In my youth, people complain about how high the divorce rate was, and it's double that today. Broken families are the consequence.
Yeah.
It's really terrible. We know from big study in the United Kingdom that men over the age of 70, and it's probably true for women as well too, who have sex twice a week have their risk of cardiovascular death. They're going to die anyway, but they have the risk of cardiovascular death. These are striking things. And
so this is one of those things that's fascinating to me, Elliot, because it's, there's so much emphasis on dealing with things when there's a pain point, and less emphasis on how do I monitor and be proactive about things that are indicators in life, indicators of problems, and all these different aspects. And they both are important, but what you're describing with what you do and the research you've got, what you've created, is a way to monitor some natural functions, hopefully natural. And if you don't have them, then that's a marker of something.
That's a problem. That's right.
And so then you can at least treat it the right way, or ask the right questions, better questions, because you got more data. And I think that's profound, because there's so much emphasis on women's health that men's health is kind of sometimes put aside. And I don't mean that as a slight, but there's an element of that.
They get all the attention. But women are wrong. By age 50% of men have erectile dysfunction, or let's call it arousal disorder. It's higher. It's higher for women. But what do women have? To be totally, I hope this isn't too graphic, but women have vibrators. So in my lifetime, vibrators have gone from my mother's bottom dresser drawer in a supply closet to I don't know how many my wife owns. She must be really open-minded about these things. My daughter took them on dates. She's engaged right now. So it's been mainstream for women. Men don't have any. Men have pills that are ineffective, and they prescribe pills that harm them. So the women have this notion that men have these erection pills, Viagra and Cialis. They're only 20% more effective than placebo. Well, that's not a whole lot good. I've got men I prescribe Cialis to who say that works if it's in their wallet, or if it works if it's on their night table. The placebo effect is. Hey, look, the placebo effect is powerful. If you went to my bathroom,
placebos are real. I mean, that's a real component of, because the brain is an incredibly powerful thing. So you're not wrong.
But I want to deal with the objective world. The subjective world is really powerful, but I want to deal with the objective world with this company with Firmtech. So if you went to my bathroom right now, you'd see a whole bunch of supplements. Do I think they work? Probably not. I think the vitamin D3 is probably valuable. I live up north, but the rest of the stuff, I don't know. And so we need to provide men with aids, and they really need to see these things not as crutches, but as enhancers. Yeah. So one interesting. So when we came up with this, and I will share with you that the company really is data driven, but there's a mechanical component, important mechanical component, as well too.
Sure.
And we've had 2 men get cardiac catheterizations because their nocturnal erections went down. We've had 2 men identify. One man had an adrenal tumor, and the other man had a significant hormonal problem because of the data. And there are lots of men, including myself, have used the data to adjust their the two medicines that doctors really prescribe that are toxic for men and women's sexual health are antihypertensives and antidepressants, SR antidepressants, or anti-anxiety medications. And then if they're taken in combination, it's really, really damaging to people's sexual performance, and that undermines their self-esteem. It makes them anxious. It leads to, anyway, it's damaging to their relationships. But there's a mechanical problem here as well too. So and I didn't understand this before I got involved in this business, but it occurred to me. I learned about a syndrome called venous leak syndrome. Now, for urologists, venous leak syndrome, some of the men become aware of when they're in their adolescence, when they're masturbating. They get an erection, they can't sustain the erection. But then there's venous leak syndrome of aging, which only a few urologists talk about, and I am persuaded everyone gets. So what do I mean by this? It affects men and women. I'm 71 years old. If I sat on a plane for 5 hours, my socks get tight, my rings get a little bit tight. Why? Because the smooth muscle around my small veins and the vessels themselves are getting stiff. They just don't pump blood back to the heart the way they did when I was 25 years old. This happens to everyone, even people who are in good physical condition, not just people with hardening of the arteries. So what happened? What do the penis and the clitoris need? I hope you don't mind my being graphic. Need in order to function? Well, the number one thing they need is blood flow. And we all suffer from decreased blood flow as we get older. So as blood goes into the penis and the clitoris, it has to leave as well too. So it's leaving the penis is much more obvious than it is than leaving the clitoris because the erection goes away. Most men's problem is not that they can't attain erection; it's that they struggle to sustain erection, especially as they get older. I'm sure you had this experience when I was 14 years old. I could hold a girl's hand and stay hard for an hour and a half. That doesn't happen to me at age 71. I'm happily married, but that didn't happen. You don't see it's just and why? And
Things change.
Part of it is that things change. The part of that is psychological and repetitive. It just doesn't work. But a good part of it is aging. It's venous leak. Every erection ends with blood leaving the penis through the veins. So for men, this is a problem that can be addressed mechanically. So erection rings, you can buy a sex toy store. They made it out of hard silicone. They made the same way for 150 years. They pinch. They're uncomfortable. For men with compromised circulation, like men with diabetes, hypertension, they can even be dangerous. You can't leave them off in 20, 30 minutes. And they're chokehold on the penis because they're cutting off the arterial blood flow. You have to have an erection first in order for them to work most effectively. Our rings are made out of soft elastomer. They allow blood in. They only constrain the venous return. So they basically do what your muscles do and your small veins do when they're younger.
Right.
They hold the blood in the penis for a long period of time. So what we've discovered is that our rings, and there'll be a paper published this fall about this, our rings keep the penis aroused hard twice as long as 10 milligrams of tadalafil. Well, that's a game changer because what do men do when they have ED today? They get a pill, but maybe the pill is not the best approach. I think most men should put a ring on.
Because you got a lot of side effects that come with that kind of medication. Because I hear lots of different clients and people that I know in my life that talk about, it's something I'll do, but they're not like excited about it.
No, and they're not. And a pill, a comfortable ring. I just hear this from I'm not calling my patients, but they're really my customers. I hear this from older men 55 and up all the time. 2 or 3 times a week about how the ring has changed their lovemaking. Now, my wife and I were surprised by this. So let me just go to the female side, though. So when women get older and women have the same premenopausal women have issues due to they take more anti-anxiety medication and they take hormones for birth control, and those things affect libido. So utilizing a device that we are developing for women in the future, and we'll come out with this next year, we'll be able to say, hey, what dose of hormones works to me? At what point, because this data is all not just objective, it's personal. And to bitch about doctors again, we doctors treat everyone as if they're one size fits all. We give them all the same dose of medication, regardless of gender, weight, et cetera. And that is stupid. The data that we're getting from our device it's objective, but it's also you.
Right.
You can be your own test subject. But postmenopausal women have all the same problems that men do with heart disease, with cardiovascular disease. What's the impact on their clitoris? Well, the clitoris, it's harder for the clitoris to hold blood in, harder than it is for men because the penis is surrounded by epidermis. Blood can't leak out of the penis. The clitoris is surrounded by a membrane, and the serum,
Right.
which is the fluid in the blood, not the blood cell, the fluid, actually, that's the responsible for most vaginal secretion. It leaks out, and also there's less of it because there's less blood coming into the clitoris. So what's prescribed for women is estrogen cream, which is effective, and also if doctors will almost never recommend this, but vibrators. What if vibrators
Right.
work two ways? The neurological pleasure stimulation of vibrators is kind of obvious, but the other stimulation is the vibrations sustain blood flow. They stimulate the blood vessels, the artery, small arteries, to stay open.
Interesting.
And this is, no one talks about this. I don't know.
Right.
In fact, now I've read about more of the mechanical research. It's like kind of like duh. Vibrators don't work as well for men because our blood supply is a little bit deeper, and also the vibrate. No one's really figured out in men what vibrations are stimulating, what vibrations are numbing. But getting back to women, I'm confident the next 3 to 5 years, testosterone therapy will become the norm for women. Because if you think about this, postmenopausal women, they gave estrogen replacement therapy, but they're not giving testosterone replacement therapy. What is that? It's bizarre. Right. I mean, women produce testosterone in their ovaries. If we're going to, and I don't regard this interference, but if we're going to sustain the gifts of nature with hormones, why do we limit it just to female hormones, not the male hormones? Women who, and this is all, you might get a mustache, you might get pimples. Well, it's dose related. Again, it's
right.
If you get a side effect, you're probably taking too much. But I see this with men who are taking these things. And so what testosterone therapy does for women is it restores their libido. Sex doesn't become, hey, if I get turned on, I'm in the mood. It becomes, now I feel like I'm 35 again. I actually want it. And that's a game. That our goal. One of my goals is to help people sustain the most important relationships in their lives, their romantic partnerships, and ideally their marriages, really, because I'm a strong proponent of marriage. As you probably are as well too. And
you and I both.
So if a common issue in marriages, postmenopausal, is the wife doesn't want it anymore, and then the man feels it's in a position, she feels in a position, but if you can change that with simple things like on the female side, a vibrator and ring and a little bit of testosterone, and on the male side, if you can address his issues with a ring, it's just these are very simple solutions.
Yeah.
And so that big pharma is going to advocate because pharma doesn't make any money off of these things. I'm sorry. Go ahead.
Right. No. So with what you've created for men, the ring, is this something that is like wear it every night? Just do it. I mean, what's the optimal process to get the right kind of data to help yourself, both with health related and then also with sexual related?
It depends on what the man's problem is. If someone does not have high blood pressure and they're 60 years old, hey, take it once or twice a month. If you have high blood pressure, you should probably be taking it a couple times a week. It's just similar with our data. I mean, I check my data 2 or 3 times a week, but I don't need to. I don't have erectile dysfunction, and I'm blessed with good health. Well, technically, everyone gets erectile dysfunction. I don't have erectile dysfunction as the doctors would define it. I'm certainly not 18 years old again. So I check. I check. I think a man should check the data. If the data is normal, first we recommend get 4 to 6 readings. 4 readings overnight. They don't have to be consecutive, and then because it takes time for the sensors to adjust to your body, and then a couple of readings while you're having sex, and then you've established your baseline. It's kind of like going to the doctor when you're 50 for your annual physical. They don't just say, "Hey, Corey, you look great, dude. Come back next year." Yeah. No. They get a blood test, electrocardiogram. They do other things that establish a baseline. So if you come back, you have a problem, they can then compare your situation to that.
Right.
And ideally, and you made a great point earlier. Ideally, you want to address problems when they're subclinical, when they're not apparent, before they become overt.
Right.
When they're overt, it's often a lot harder to deal with them. So I would, men should treat this the same way.
Yeah, and here's just a quick case study that this just happened with I was just informed by a guy that he had a heart attack last year, and he's a younger 30s, 40s age man, and he made a comment of one of the things that, looking back at it, that was a signal of a problem was the firmness of my erection completely changed prior to.
Yes.
And then that was a marker of like exactly what you're talking about. Like,
the
wait,
doctors
there's
don't ask about it.
something going on here.
Yeah, they did. One of the two men I'm aware of who contacted me, who got a catheterization, was 48 years old. He went from 5 to 2, and we sent him a notification, and he recommended that he see his internist and end up getting catheterization. So yeah, it's a vital sign, and it's one that should be pursued. Now the ring, as far as the ring for purposes of sex, that's different. We make two products. One is, are we on camera right now? Oh, this is what the tech ring looks like. So it has sensors, built into it, and it can be used as an erection ring. It can be tightened or loosened depending upon a man's size or comfort. We make a ring specifically to enhance sexual performance that we call the maximum performance ring. Because once I made the tech ring, I realized, why don't we make something that will help men the way vibrators help women,
right?
To last longer and to have more pleasure. So our goal was to increase the ejaculatory phase by 50%. And by doing that, to produce a more profound orgasm. So the maximum performance ring, which is another product that we sell, we don't get 3. For example, it increases my ejaculatory phase from 4 seconds to 7 seconds. Well, I never used erection rings before this. For me, erection, I happen to be married to someone who's open-minded and thinks the sex is fun, which is great. So we do play with sex toys, but erection rings or cock rings are always like a novelty. You buy it, doesn't work, you get rid of it. Maybe it's a Valentine's Day thing or a birthday thing, and
right.
We never liked any of them because she felt they were uncomfortable because she didn't like the hard silicone, and I felt they pinched. When I came up with the maximum performance ring, we don't have sex without it, and my wife's idea of foreplay is to drop it in front of me. Men are pretty easy; we don't require much. So
right.
Why is that? One, and this is an important message for people for couples. If you're in a committed relationship, ideally in marriage, you want to you and your partner's sexual satisfaction is for almost everyone. 99% of the time is really important. As men get older, they start to lose their confidence because they lose their erections faster. Women don't understand also that as a relationship goes on, certain positions become boring, and couples need to be more open-minded about this, and they need to discuss this.
Right.
Again, my wife here should feel comfortable saying this, and I'm going to say it which is things change after women have babies. My wife has 3 babies. There are certain positions that she still likes, that whether because of friction or because of boredom, repetition, I will lose my erection as much as I want to please her. That's a source of stress for both of us. With a maximum performance ring on, she knows I'm going to stay hard, and I know I'm going to stay hard, and that's a game changer. So we now make love differently. And I think this is common for a lot of older couples. And I'm older than me, like married 5-10 years. It could be in the 40s, or even 30s. People, if a man is confident and a woman's confident that he's going to keep us to stay in erection with less stimulation, they start making love differently. It's more romantic. There's not the sort of rush to orgasm. Oh, we're both turned on. We got to do it right now.
You can relax in the process more because you're not so much focused on the performance of it as you are the experience of it.
Correct. That's exactly what it is. So we actually took a survey of a group. We did a Sex for Seniors webinar, and there were, I don't know, maybe 10, 11 couples, age 50s on up. Who we actually did a slide survey with. Are you making love longer now that you have this ring, the maximum performance ring? And they all said yes. And not longer, but often more often because they're more confident. So we don't make love for 10, 12 minutes now. We make love for 30 to 45 minutes. And we make love in different positions, and there's a lot more talk. There's nothing that a lot of women don't understand and men laugh about. Now, maybe this is not your wife, Dr. Corey, but a lot of women in the middle of making love will suddenly start talking about something else. It could be a fight they had with the kids, something that went on at work, something with their parents. My wife, even like a week ago, started redesigning our bedroom. It was a really good idea, but I didn't really want to hear. I will. I'm a man. I will share with you that prior to having the ring, I would have gotten angry. I would have been. Can't you keep that death and thought to yourself for the 5 minutes? The first time when I came up with a ring about a year and a half ago, February, the first time we had a prototype, I was in Montana, and in the middle of making love, my wife suddenly says, "It's February. Oh, I left the garage door open." Now, it's not the assumption in these circumstances that she's going to jump out of bed, close the garage door, and come upstairs. The assumption, even in this age of equality, I don't know, is that I'm going to do it. And I'm ordinarily, previously, without the ring, I would have been angry, and we probably would have ended with, it would have been a grumpy night, I'll put it that way.
Right.
I went downstairs, and not only was the garage door open, but the rear car door was open because she's probably taking packages out and left it open. And it was snowing. As I'm coming back up the stairs, she says, "Oh, you know that tequila I like? Can you put some on ice for me?" Now, ordinarily, because I'm a mortal, that would have led to another explosion of male WTF anger at what? Get it yourself.
Right.
But I got the tequila, and I came upstairs, and she laughed, says, "Well, the garage door was for real, but the tequila was a test." She pointed, and I was like 80% hard with the ring. And she said, "You see, you're in a different mood when you have an erection." And that's right. A man with an erection is in a very different mindset than a man.
There's the quote. There's the quote for the show right there. You're in a different mood when you have an erection.
Then when you've lost an erection, that's when you're.
That is true too. That does change the way you feel and view yourself for certain. Okay. Well, Justin, this is fascinating because I think it's so important to recognize how just our bodies tell us things, our actions tell us things, our inactions of things that will normally work. Because that's the whole idea of aging, changing. Yes, I do have to recognize things will shift and evolve, but I also have to recognize, man, I can still enhance some things. I can help with resources with some things, and I can also use some stuff to monitor just to make sure I'm in optimal health and caring for myself and my relationship better.
We're all of us, men and women, on a road from fitness to dysfunction, and we don't know where we are in that road. We'd all like to just hit a stop sign or make a U-turn. We don't know where we are on that road because we don't have a dashboard and we can't look under the hood. Men now, utilizing our tech ring, can now look under the hood and check, I'm crude analogy, but check the battery, check their fluids, and see where they are, and see where the problem is. Is the problem that I have high blood pressure? Is the problem that I'm an alcoholic? Is the problem that I'm taking a beta blocker for my blood pressure? Yeah, and I think that's a game changer.
It absolutely is, and I love for the lack of a better phrase, Elliot, the simplicity of it, in the sense of, I know it's a whole lot more involved. It's not simple data and tech that you've created, but the simplicity of, monitor some things that are just aspects of life and aspects of a man, and enhance some things that are aspects of life and aspect of a man, and that's a great path to go forward. So as we wrap it up, tell people how they can find you, and I'll put the information in the show notes as well. But if they want to learn more or pick something up, how do they do that?
Sure, you can find us at myfirmtech, myfirmtch.com, and you can reach me directly at Elliot, ELLIOT, at myfirmtech.com. Perfect.
Well, Dr. Elliot, I appreciate so much a willingness for an MD to dive into this subject, because you're so right. There are several MDs I've had over the years on as guests on Sexy Marriage Radio, but there's not a lot in comparison to how many MDs are out there. It's because there's not, like you're talking about, that you have a specialized training, and being able to apply it to this aspect of life is so vital. So thank you so much, man.
Thank you. It's been a pleasure.